Secretary of Health together with Undersecretary Dulay and Undersecretary Gerald Bayugo will be sitting on the press conference regarding the preparations on the repatriation of the OFWs. The Health Secretary will now give his statement.
Okay, thank you very much, Dr. Meng, and good afternoon, everyone. I am joined in by USEC Jerry Bayugo and DFA USEC Dodo Dulay during this press conference. And I'd like to report to our people that after an inspection facilitated by the Bases Conversion Development Authority President and CEO, Mr. Vince Dizon, in Capas, Tarlac, together with the representative of the Department of Foreign Affairs, the Interagency Task Force on Emerging Infectious Diseases has finalized the protocols and procedure to be implemented for the repatriation of overseas Filipinos coming from Hubei Province, China. To ensure the health and safety of Filipinos in Hubei Province, China, the DOH has recommended the voluntary repatriation of all overseas Filipinos in the province due to the 2019 nCoV-ARD outbreak. I would like to highlight the necessity of a whole-of-government approach in the implementation of the repatriation and quarantine process, and take this opportunity to convey our gratitude to the BCDA, which offered the use of the new Clark City as a quarantine area for repatriated Filipinos. We plan to bring back our fellow Filipinos here in the country as seamlessly and efficiently as possible. Procedures were set into place from the moment our OFW kababayans board the plane up until their arrival at the new Clark City. While on board, repatriated OFWs will be oriented on the quarantine process and will be asked to fill out health cards. Centralized processing of all immigration documents will also be done. Upon alighting the plane, the BOQ shall screen all passengers. All OFWs with symptoms shall immediately be admitted as patients under investigation or PUIs at identified ready hospitals, while asymptomatic OFWs will be transported to the quarantine facility. The BOQ will coordinate the disinfection of all luggages and the plane use, while the Center for Health Development, CHD Central Luzon, will be in charge of disinfecting the vehicles used for transport. During the quarantine period, one room will be allotted per person to ensure patients' safety and convenience. The room can also accommodate a family of 3. The movement of the quarantined people shall be limited to the building only, and packed lunch will be served and prepared for them every day within the facility. By the way, the rooms have televisions, each one of them, and a refrigerator, air conditioned. It's such a nice place, very nice rooms, and we believe nothing less should be provided to our kababayans or FWs. We will be providing the needed medical. DOH will be in charge of management, coordination, and logistics of the entire quarantine process. All DOH hospitals in the region will deck for the deployment of medical teams in the quarantine area. We will be providing the needed medical logistics, including hygiene kits, disinfectant solutions, transportation, and other things that will be needed in the quarantine process. Upon completion of the 14-day quarantine period, the discharge of all repatriated OFWs shall be facilitated by the Overseas Workers Welfare Authority in coordination with the Department of Foreign Affairs. Rest assured that all our kababayans will be treated with utmost care and dignity as they go through the whole process of repatriation. Their comfort and welfare throughout the process is of utmost priority to our President Rodrigo Roa Duterte, and the Department of Health. and I conclude. Thank you.
Thank you. We will be entertaining 5 questions, 5 to 6 questions right now because there's an ongoing interagency task force meeting right now. So let's start with the questions.
Yeah, we have pictures. Can you show the pictures?
Prior to that, let's just show pictures of the facility.
This is the conference. Let me just check my notes. Yes. This is not the one. This was with the Mega PRC yesterday. So another. That was yesterday. Unless they did not give you. That was my meeting yesterday. So where is the one for the new Clark City? Was that provided? Okay. There. Yeah, this is part of the place where the OFWs repatriate, to be repatriated, looks like. No? So what are the other pictures there? Very quickly. So this is like part of the mess hall for the medical staff, and then that's the way this looks. Very well lit, very spacious, very clean. Next. They have a swimming pool, just in case they've been under stress for the longest time. It might be good that they can, but that the movements will be controlled, kasi kailangan makasiguro tayo, no? But this just to show the facilities of the new Clark City and this particular building. This is building B, no? Building B. Oh, this is the hospital, the polyclinic hospital inside the facility. So meron na rin. Okay? Complete. Yan lang. Asa pa yung iba? Wala na? That is the meeting at the Clark Air Base where the plane is going to land on the morning of Sunday. Very early morning of Sunday. Okay? That is a meeting with the administrator. We have the Bureau of Quarantine officers and the representative of the DFA on screen. So next slide. Yeah, this is the sample of the room. Okay. Hindi nyo na organize yung mga... What's the next? Wala na? Yeah, this is the bed. Hindi mo ba lang pinakita yung aircon? Baka hindi sila maniwala na may aircon. Wala na? Mau? That's it? Yeah, refrigerator, television. Okay. Organize. Yeah, yun yung part, the receiving room ng polyclinic. That's the room. Ay, yung aircon. Ano pa? What is this? This is the part of the polyclinic hospital. It's a primary care. Well, it's a polyclinic. That's what it is. Ano pa? Okay, so that's it. Pasensya na. It was in a rush that these pictures were taken. The question answer portion. Yeah, sige. Papakita ko lang ito. This is the building. This is the building A. This is the building A where they will be. And building B, that's building B for the staff yan. Okay? Yeah. So, I'd like to hand it over to Yusek Jerry to explain a bit.
Thank you for, sir. Actually, this is the complex that will be used for the quarantine. It's part of the nuclear activity village. And this building here, building A, is where our repatriates will be housed for 14 days. And this other building is where the other facilities, our medical staff, preparation of food, and all the other support personnel with isolation room if there is a need to isolate patients who will develop symptoms, hopefully not. So they will be immediately separated and brought to this room and immediately transferred to our hospital. So ito po yun. This will be cordon. There are constructions ongoing here, but the management of NCC is going to provide a wall here so that there will be restriction of movement of people and confine everybody within this facility. So yun po, the land, but there is very easy access from the NX to the nuclear city facilities, and our people, upon landing at the Clark Airport, will be transported by bus to the facilities.
Thank you, Yusek Jared. Yes, questions please.
Yes, sir.
Secretary Dokia, you mentioned party kanina na there will be restrictions. Ano po yung mga pwede at hindi nila pwedeng gawin while inside the facility, considering na they're under observation?
The planning group will still have to come up with the list of do's and don'ts. Okay, so we'll wait. I don't want to preempt their announcement, but certainly there will be restrictions for better control and ensuring that they will not be contagious, or all the preparations are being put in place with the end goal of ensuring that they do not put other people at risk, and that is why we need a controlled environment, so to speak.
At yung airport po ay sa Clark International Airport.
Tama po kayo.
Next question, sir.
Sir, just to clarify, we are using the athletes village of the Nuclear City, which was used during the 30th Southeast Asian Games. Was it offered by the ABSCBN, sir, or it was the DOH who chose the facility?
It was offered by the BCBA, and that's why I said in my press statement that we convey our appreciation to the BCBA for coming forward to offer their facility.
So, sir, just for the record, why is it better than the phase 4 of the Mega Drug Rehab Center, which is also kind of isolated from the community?
Well, it's much more strategically located. One. Number two, the facilities are more complete. The ambience is very nice. It's well lit. It's open space, and so the rooms are with almost complete amenities, with refrigerators, television, individualized toilets, which is very, very good, unlike in Fort Magsaysay, where the toilets o yung palikuran ay dapat they will have to share the toilets. No? So this one, not to belittle the Fort Magsaysay's facilities, in fact, we continue to improve the Fort Magsaysay facility, so to be prepared, just in case there will be more to be repatriated, it's better that we proactively provide adequate quarantine facilities down the road.
Ma'am Trisha, Sir Gerald.
Sir, we need some details about the repatriation. How many Filipinos already will be repatriated? When will they be repatriated? And at the same time, Yusek, do we already have the clearance from China?
As of today, as of this moment, there is now 45 OFWs who have signified their intention to join the repatriation. Of course, there are two aspects to this that we have to fix. The first one, of course, will always be the exit permits of our OFWs, which we are fixing now. Of the group, there are 4 who have a problem with their immigration status, so that's being fixed right now. If the Chinese government is unable to give us the clearance on that day, then they will most likely be in the next batch if there is any. But insofar as those whose immigration status are updated and they have no problem, they will be brought to the plane side. Now, the agreement here is that of the 45 that we are supposed to bring back to the Philippines, they will again, as they are required by the Chinese Health Commission, they are required to undergo another check before they board the plane. And if they are found to be with a fever or any symptom of the nCoV, they will be taken by the Chinese authorities to their hospital, to their facility for treatment, and they will not be boarded. Aside from that, I understand that the Department of Health, through Secretary DOH, has also established protocols prior to boarding to ensure that our kababayans who board the plane are ready, in fact, to take the trip. So as of today, I'm reporting that we have already 45 Filipinos ready to go. Now, I also would like to report to you that today we already have our BFA team inside the hot zone. They have entered Wuhan City today, and they are there working on the ground, preparing for the repatriation of our OFWs. Unfortunately, I have to give it credit. I have to give credit to our people. They are on the ground and they're taking the risk because they're going on the ground really, basically bare without the hazmats. But they've taken on the task, and I salute them for doing that. But they are on the ground and they're talking now to the Chinese authorities. They are talking to our Filipino community there in Wuhan to fix the repatriation. The details of which are still being fleshed out as of today because there are a lot of permits and clearances that we need to follow. I just like to emphasize that the repatriation is not solely a Philippine-dictated procedure. It entails coordination with the Chinese authorities. It requires our compliance with Chinese rules on the containment of infectious diseases. So all of this, we are working closely with the Chinese authorities on the ground. And I'm also pleased to report that they have been very, very cooperative with our efforts to repatriate our Filipinos. Thank you.
Sir, just for the record, we don't have permit from China yet. And may we know the tentative date of their arrival?
Well, we're working on a February 8th departure. And that will mean a February 9th early morning arrival. However, that is not a fixed date or time because again, the process is not only controlled by the Philippines. We have to comply with the Chinese rules that are set on the ground. And we understand the reason for this. They also want to make sure that the protocols inside the hot zone are followed. So we comply with the host country rules.
So, sir, as of the moment, no permit from China yet?
Not yet. They will not. It's all being fixed right now.
Question. Sir Ran, Secretary, how many personnel from the DOH will be flying over to China? And that's one question. And then the second question is, we understand that you said that one facility can house a member of 3 people. What if the family members of those being repatriated decide to come over? Will you be allowing them to enter?
Let me answer the first question. The number of personnel that will join the group that is going to take our people, 5. We have already identified the brave 5 personnel of DOH, 2 doctors and nurses. So they will be joining the flight that will go to China. As far as the spouses or family members, maybe I can pass the mic to you. Yung mga
On the spouses, if they are Filipinos, obviously they can join. Those who have foreign spouses, then remember that all nationals, foreign nationals in China, including Filipinos in China, have to secure the permits from the Chinese government. So that will be part of the process that has to be taken. If they are given the permits by the Chinese government, then by all means, we will decide whether they can bring them along. But right now, we don't have the permits from the Chinese government for them. They have to ask for those permits themselves.
Yung family po dito, sir, syempre baka gusto nila salubungin.
Okay. For the well-wisher, I think the DOH has made the protocols for that. Maybe they should answer that. For the well-wishers.
Yes, yes.
The quarantine means very, very minimal contact. And so it is not advised that the families will go there to meet with them. It will be limited to certain hours of the day where they will be able to communicate through Wi-Fi. So there will be some kind of communications that will be ensured. So that's to answer your question.
Okay, last two questions because there's an ongoing meeting. Janelle and then Aiko.
You said Gulay. So you said that there are gonna be, and here, there are gonna be 45. That's the first batch. Do you have any idea how many Filipinos are in Wuhan and Hubei province, and how many might want to be repatriated in the next batch?
Well, this is not a forced repatriation. This is really a voluntary return. So Filipinos who would like to join and be repatriated is still open up to now. We can receive applications now, but so far we have not gotten any more than the 45. So we're waiting. Any Filipino who wants to come home in Wuhan, I just need to make sure that it's in Hubei and Wuhan because that's the area that's really in lockdown. Can come home. They can join. Yes.
Sorry, but have you made any projections as to how many trips there might be for repatriation?
We take it a step at a time because if there's no one applying to be repatriated, then there's no reason for us to prepare for another repatriation flight. So we will, but of course we're always ready for that eventuality, but we cannot firm up any details of the next flight unless we know who many and how many are coming for the next batch.
Okay, absolutely. Last question for DOH. How many health workers will be at the facility? How many DOH personnel and health workers? And also, Secretary Bello said something about a Filipino who died due to coronavirus, although he didn't say it was nCoV. Okay, do you have any news about that?
Sorry, I have not been made aware.
But how many health workers will be in the
There will be a decking system between 4 hospitals, the Bataan General Hospital, the Jose B. Lingat Hospital in San Fernando, Pampanga, the Paulino J. Garcia and Talavera, and the Mental Wellness General Hospital in Marilanes, Bataan, 5. So they will go on deck. So exactly how many will constitute a team that will be made to go on duty is something that we will be able to determine as soon as the completed plans are provided.
Aiko, last question.
Secretary and also Yusek Dulay po, just like to ask about the quarantine period sa cruise ship on the Filipinos and meron nag-positive po. Just like to ask sir if pagkatapos ng quarantine period there, will they be allowed already na bumaba sa barko and have again their normal operations? And for example, if an OFW or a volunteer returnee comes to the Philippines but quarantined na po siya doon in China, for example, back to zero po ba yung quarantine na dito or tuloy po yung hindi niya po natapos sa ibang bansa?
get the question on the cruise ship. Can you
Yes.
clarify?
Yusek, there's an ongoing quarantine period po.
That's right,
There's a
yes.
cruise ship in Japan.
Yes.
And a Filipino was tested positive of
Yes.
2019 and COVID there.
Yes.
Yung after ng quarantine period nila, will they be allowed to have their normal operations again pagbaba po nila doon sa cruise ship?
Well, I think that is for the Japanese Ministry of Health to decide. Our Tokyo embassy is in constant touch not only with the Japanese ministry, but also with the Filipinos on board. So we are waiting for the results of the tests being done. I understand there's still tests being done by the Japanese Ministry of Health. Whatever happens after is really the call of the Japanese ministry. If they decide to allow the cruise ship to berth or not, that's something that we leave up to the Japanese authorities because they have jurisdiction over that particular matter.
And yung regarding naman po dun sa volunteer attorney, sir, if ever the volunteer attorney has undergone quarantine period there sa China, tapos gusto po niyang umuwi, will he be allowed to be quarantined again? Itutuloy po ba dito? Or back to zero po siya sa quarantine period?
Back to zero is our policy. They have to be quarantined.
Okay, last question. Last question na pa talaga.
Sir, may info about a Chinese national who flew from Manila to LA via PAL and is now positive of nCoV. Do you have any information?
Wala po.
Filipino in LA.
Wala pa po. Baka bukas na natin. There has been no report submitted to the DOH.
Sir, may patanong lang po. Bukod sa updates of PUI, sir, can we ask you to react on this? Filipino Nurses United had a press conference this morning. They're calling for sufficient protective gear for frontliners, and they're calling for transparency of the government in disseminating information. Any reaction to this?
There has never been a time where the DOH has not provided the personal protective equipment where appropriate. We cannot just provide everyone with the PPEs if they're not really frontliners in terms of providing care to patients. So that the protocol is very clear with regard to that. And then the other one, more transparency. We couldn't be more transparent with the daily updates that we have been giving. If they have any brighter idea of what greater transparency is, they're most welcome to tell us, to write us a letter how we can further improve.
Sir, just
Okay,
one
thank
more.
you very much. Very last.
Very last, sir. Just an update on the cremation, sir. Do we now have a crematory that accepted the nCoV, the patient?
Yeah, it's very unfortunate that the crematory owners have decided not to for not very clear reasons. So I instructed the medical center chief of San Lazaro Hospital to coordinate with the public cemetery and see if the corpse can just be buried there, because the latest information is they don't have a cremation process there. So I'll just have to wait. And they have to also get in touch with the Chinese embassy because the initial agreement was for cremation to be undertaken. So now that if it's not going to be cremated and buried instead, I don't know what the protocol is as regards that.
Sir, do we have updated PUIs?
Yes, I do have as of 12 noon today, I am reporting a cumulative total of 178 patients under investigation for the 2019 nCoV ARV. Of the 178 PUIs, 147 are currently admitted and isolated, 10 have refused admission, and 16 have been discharged under strict monitoring. Out of the 178 total PUIs, 48, and I repeat, 48 have tested negative for 2019 nCoV, while 3 previously reported cases have tested positive and 127 results are pending. I urge everyone, including our PUIs, to please cooperate. Sama naman kayo, ha? yung cooperation ninyo, napakamahalaga po ito na ang DOH ay nagpupursige para talagang atin mapigilan ang pagkalat nito. Kaya malaki po ang papel na kailangan gampanan ng ating mga symptomatic patients or PUIs at kailangan po gawin natin ang kanya-kanyang papel o ang dapat magampanan para banta ng nCoV ARD ay talagang mababa o kung hindi naman ay mawalan ng tuluyan. So, ngayon, sa kasalukuyan, kami po ay nakikipag-ugnayan sa Philippine National Police para talagang pilitin na itong mga PUIs who are refusing hospitalization to be admitted and managed properly. So, we are already coordinating with the PNP to compel these PUIs to agree to be confined and undergo isolation and testing.
Okay, thank you very much. So that concludes our press briefing today.